Dr. Ashish Markan. He'll be speaking on MIVS assisted SFIOL, tilt and decentration measurements using OCT, anterior segment OCT.
Yeah, a very good morning to all. So I'll be talking about 27 gauge MIVS assisted scleral fixation of intraocular lenses and AIOS2025-FP-Trauma-II guided study. So we know that a number of sutured as well as sutureless techniques for SFL have been described, and amongst these sutureless methods have gained popularity as they bypass the risk of suture related complications. Techniques such as Jimenez has gained popularity in the recent times, and but it is associated with a long learning curve. Alternatively, a number of modifications have been described to the Jimenez technique, and we have also modified a technique using 27 gauge instruments, and we tried to study the IOL metrics using the AS-OCT in the postoperative period in the patients who underwent this SFIL surgery, especially patients with traumatic dislocations or subluxations. So this was a retrospective study. All the relevant preoperative, intraoperative, and postoperative details were collected. Postoperatively, all the patients, they underwent AS-OCT on Anterion at 1 month of follow-up to look at the following intraocular lens metrics, that is the IOL tilt, IOL decentration, and the distance of the IOL from the posterior iris surface. Exclusion criteria include the secondary glaucomas, the corneal opacities, previous retinal pathologies, and optic neuropathy. IOL tilt was defined as the angle between the corneal topographic axis and the central axis of the IOL. IOL decentration was defined as the distance between the fixation point on the corneal topographic axis and the central axis of the IOL in the cornea. And the distance of the IOL from the posterior iris was defined as the perpendicular distance between the posterior surface of the iris and the IOL at the pupillary margin. Postoperative details were collected. A pars pinna vitrectomy was done in all the cases associated with posterior lens or IOL dislocation or associated vitreous hemorrhage. An anterior vitrectomy and a thorough port side vitrectomy was done in all the cases. Intraoperative surgical videos were reviewed to assess any complications encountered during the surgery. Necessary statistical analysis was done. Just a short video to show how the surgery is done. After securing the infusion, two 27 gauge trocar cannulas are inserted roughly at 1.5 millimeters along the horizontal meridian. So after this is done, now the intraocular lens is being injected, and using a 27 gauge max grip forceps, the leading haptic is being held and is extruded through the trocar cannula. The cannula is pushed onto the shaft of the forceps, and then using the heat cautery, the ends of the haptic are being flanged. A similar procedure is done on the other side. Once this is done, now the haptics are being tucked into the scleral tunnel, achieving a well-centered IOL. And the infusion is being taken out, so it is more of a sutureless, flapless, glueless technique for SFIL. So now coming on to the result, a total number of 36 patients were included with a mean age of about 34 years. Male to female ratio was 29:1. Indications were the traumatic dislocated or dropped IOLs, traumatic phacodonosis, subluxations, posterior lens dislocations, or previous surgical aphakias. The pre-op mean BCVA was 0.85, pre-op mean IOP was 16, and pre-op mean endothelial cell count was 2400. Postoperatively at 3 months, the mean BCVA improved significantly. The IOP as well as the endothelial count was more or less similar with no statistical significance achieved. Now coming on to the important measurements, that is the AS-OCT measurements in the postoperative period, we found that the IOL tilt was 3.58, the IOL decentration was roughly 0.22 millimeters, and the posterior iris surface to IOL distance was 0.76. Now this is important because about 5 degrees of IOL tilt and about 0.2 to 0.3 millimeter decentrations is clinically tolerable to the patients. And the postoperative complications were that 4 patients, they had an IOL tilt requiring a repeat surgical intervention. 3 patients developed vitreous hemorrhage, which cleared on its own within a period of 1 month. And 2 patients developed choroidal detachment, which again resolved within a period of 2 weeks on oral steroids. Now, the mean refractive spherical equivalent was 1.14. That means all of our patients had a mean hyperopic shift. And when we tried to correlate them with the IOL parameters, we found that there was a positive correlation between the posterior IOL to the iris distance, whereas there was no correlation between the IOL tilt as well as the IOL decentration. These are the graphs for the correlation. So to conclude, 27 gauge MIVS technique for SFIL demonstrates a favorable outcome in terms of IOL tilt and decentration, contributing to improved visual acuity and reduced postoperative complications. Just looking at the review of literature, we found that the tilt in our cases was more or less comparable. Smaller is the gauge of sclerotomy, lesser is the tilt achieved, and the IOL decentration was significantly lesser to what has been achieved has been reported in the literature. Thank you. And just a heads up about the upcoming conference, the Comprehensive Cataract Conference in Delhi. Yeah. Thank you.
You don't need need to mention that. You're not supposed to mention that. Sir, can you come to the mic?
What was your primary objective?
So we were
Measurement of tilt or showing the newer technique of SFIOL?
primarily both, sir. So the technique has already been described once. There's just one paper on 27 gauge which came recently before we started doing this study.
Are you aware about AIOS lens design?
No, sir, I'm not aware.
You should. Which is already in the market.
And at the same time, when you are just putting cautery on the Prolene suture, mind you, Prolene is very strong suture, which actually need to hold the lens, but at the same time, if you cauterize, there can be sometime suture
No,
granuloma.
Prolene sutures were not used. This was the
it-
3-piece IOL, and we did
No,
the
no, I'm
cautery.
talking about the Prolene suture, which you cauterize the end of the suture, right? Just to make it
No, that was the tip of the haptic.
haptic, okay, haptic, polypropylene.
Yeah.
Okay.
Thank you.